Former Minister of Culture, Youth and Sport, Dr. Frank Anthony, said that it was Article 24 of the Constitution which guarantees citizens the right to free medical supplies. He said that this constitutional right has been breached.
It is very disappointing that when the three ministers spoke, that they said there's no need for an investigation. This is coming, sir, from a government who has done a number of COIs. Yet, we don't want to do a simple investigation as to why there's a drug shortage and how we're going to fix it. But you know, Mr. Speaker, this is a serious matter. And we can procrastinate, we can make all the blunders, but at the end of the day, there are patients, there are ordinary poor Guyanese out there who are suffering.
On the other hand, Public Health Minister Dr. George Norton told a National Assembly on Tuesday that the motion brought before the House by Shadow Minister of Health Dr. Frank Anthony is not true.
With your 8 speakers who keep repeating there is a drug shortage, there is a drug shortage, you would want to believe there is a drug shortage. There is therefore no need, Mr. Speaker, to launch any investigation as is requested in the Resolve Clause, and neither to report on the supply of these items to the National Assembly. But we don't have a problem with that, we can do so. Mr. Speaker, having pointed out the situation as it is in reality, that is, there's no truth in the alleged persistent shortages of drugs and medical supply in the public health system. And with regards to the different steps that we have put in place for the procurement of drugs and medical supplies, we are certain that we will correct the situation that we inherited as a new government, and we therefore cannot support this motion.
Dr. Anthony in his motion said that although the ministry's budgetary allocation had tripled in 2016 to $19 billion from a low of $5 billion in 2015, of which $5 billion has been set aside for the procurement and distribution of medicines and medical supplies, that there is countrywide shortage of basic and essential drugs and medical supplies in the country. In 2015, more than $600 million allocated for medicines and medical supplies had not been utilized. But later in the evening, Junior Minister of Finance, Sharma, in his presentation said the opposition's mathematics was wrong and that the coalition government was cleaning up the mess the former PPC government left behind.
Budget 2015, under 6221, $5.5 billion was budgeted. Listen. And the actual expenditure for 2015 was $5.1 billion. Therefore, there's only a difference of $400 million that was not spent. I'm trying to aggregate it here. Mr. Speaker, what I'm saying is that this particular whereas clause said there was no large expenditure, but figures don't lie.
George Minister Norton said that contrary to reports published in the section of the media, the PAHO WHO World Health Organization was assisting the ministry with the importation of medicine and medical supplies. He said that assistance was forthcoming not because of a shortage, but to ensure a smooth transition from the single sourcing method which was employed over the years by the PPC administration to the new procurement method which will allow small, medium and large-scale medical institutions to supply drugs and medical supplies across the country. Back to you, George.